Hi, I'm Cyrus Abbaschian. I'm an orthopedic surgeon at Texas Joint Institute. I specialize in orthopedic oncology, joint replacement revision as the primary focuses of my practice. So I really specialize in complex problems. My referral patterns largely come from other surgeons who, for whatever reason, are having difficulty getting an outcome. So it's really a problem-solving approach where every patient's different, every problem's different. And my clinics do run long because I spend a lot of time trying to listen to patients to really tease out what the exact difference is or key is that could explain why they're having the problems that they're having. So really I think of myself as an orthopedic problem solver where every case is different, every patient's different, and finding out what exactly is causing the problem is the key to making it better. My goal is to have happy patients. I think that even if everything goes great, if a patient's not satisfied with their experience and their information about what's going to happen, they typically will be left with an unpleasant overall experience, in my opinion. I wake up every day and practice orthopedics because I love what I do. I get to solve problems, help people. It keeps my brain active. There's no two cases are the same, whether it's a revision shoulder replacement, hip replacement, orthopedic tumor that I'm resecting. I work in all different parts of the body. I work in all different clinical scenarios, from a 7-year-old patient to a 103-year-old patient in the same potential day. So the variety keeps things stimulating, and I think allows to maintain the focus that allows for the best outcome possible.